Hey guys, it's Ryan, and this video we're going to be talking about selective equilibration of denture teeth. So, say we set all of our denture teeth in wax so that the occlusion is absolutely perfect. Well, it's usually not absolutely perfect, but let's just say for this instance that it is. And we send it off to the lab only for them to, well, mess it all up. It's not really their fault though, because the acrylic resin is shrinking and expanding, and the teeth get shifted all around. So usually the vertical dimension of occlusion increases, so you can imagine if we were to set those dentures back on the articulator, the incisal pin would be a little bit off the incisal guide table, as certain teeth are contacting before they should. So we would need to selectively grind away some surfaces to restore our VDO and restore the occlusal scheme that we started with. But how do we know which surfaces to grind? And that's when it gets really freaking confusing. So hopefully this video is going to help with that. And I have one drawing here that's going to hopefully help us work through it. So this is our base drawing here. And I want you to imagine you're riding the magic school bus and it drives right into your mouth and sits at the back of your tongue. So you're looking at the left side of the mouth on the left side of this drawing and the right side of the mouth on the right side of this drawing. So this is like a cross section of some molars. And this would be buccal and lingual of this side and lingual and buccal of this side. So again, this would be the left side of the mouth and the right side of the mouth. And let's say for this example that the patient is moving their jaw to the left. Okay, so both of these sides of the mouth would be moving left, and that would make the left side of this mouth, or the left side of this drawing, the working side, and the right side, the non-working or balancing side. So if you're drawing along with me, that's awesome, and this is kind of our baseline drawing what we'll work from. Okay, so let's say that when we're looking at our dentures that were processed, one cusp is just hitting way before everything else in both centric and eccentric movement. So when you're biting down and when you're sliding the dentures around, this one cusp is just way too high. So we would just grind that cusp down. But let's say it contacts early in centric, but not eccentric when we're sliding the dentures around. Then we just make the opposing marginal ridge or fossa deeper and grind that down. Okay, so that's not too bad so far, but it gets a bit more complicated, and that's when this drawing really comes in handy. So let's say there's not enough overlap. What does that mean? So say that this maxillary molar is too far lingual, or this mandibular molar is too far buccal, and they're kind of in like an end-to-end relationship. So these lingual cusps are on top of each other, and these buccal cusps are on top of each other. So that would be like not enough horizontal overlap. Well, we would grind down a couple surfaces here. We grind down the lingual inclines of the maxillary buccal cusps, which would be this one. And just before I keep going, when it says lingual inclines, that means that it's like the lingual facing incline. So if you imagine this is the face of this incline, it's facing towards the lingual side of this side of the mouth. So lingual incline means lingually facing incline. It's also sometimes called like an inner incline because these two would be the inner inclines of the molar, and then these two would be the outer inclines of the molar. So you'll see them referred to in both contexts. So again, if we had not enough overlap, we would grind down the lingual incline of the maxillary buccal cusps and or the outer aspects of the mandibular buccal cusps. And we would grind down the buccal inclines of the mandibular lingual cusps and or the outer aspects of the maxillary lingual cusps. So it would be these four right here. And that would be to broaden the central fossa and to narrow the centric cusps. Okay, so it's a little bit confusing, but as long as you follow along with this drawing and can reproduce it, That's the key to answering like an exam question. Now, say we had too much overlap, so this mandibular molar was too far lingual and this maxillary molar was too far buccal, we would just grind down the two surfaces that we didn't talk about, these two inner inclines here. So it would be the buccal incline of the maxillary lingual cusps and the lingual inclines of the mandibular buccal cusps. So let's check this out a little bit more so we can see how this works. So let's go back to our not enough overlap example. And the molars are in like an end-to-end relationship. So we would grind down those four surfaces that we talked about. So we grind this one down, grind this one down, grind this one down, and grind this one down. And now you have the effect that we kind of move these cusps buccally and move these cusps lingually. And so instead of being end to end, we kind of restore the occlusion so that this maxillary molar appears to be more buccal and this mandibular molar appears to be more lingual. So you can kind of see how that works out. And honestly, you could do this with all of the examples we talk about. You can draw them and erase the lines and redraw them as if they were ground down. So that can kind of help with the, I think, working through the concept and making sense of it. Okay, so let's go back to our drawing, and this time talk about the working side specifically. So say the buccal cusps contact, but not the lingual cusps. So these two, when we're doing a working motion here and we're moving the mandible to the left, these buccal cusps are contacting, but the lingual ones are not. So that means the buccal cusps are probably too long. So we would grind down the lingual incline of the maxillary buccal cusps. Now, if the opposite is true and the lingual cusps contact but not the buccal cusps, then we would just grind down the buccal inclines of the mandibular lingual cusps. And this is purely on the working side. So let's say now the working side contacts, but not the balancing side. So when we move the mandible to the left, teeth on this side are contacting, and teeth on this side are completely missing each other, which, if you want bilateral balanced occlusion, is not what you want to happen. So that means that teeth on this side are just too high. So we grind down, conveniently enough, the two inclines we didn't talk about. It would be the buccal incline of the maxillary molars, the maxillary lingual cusps, and the lingual inclines of the mandibular buccal cusps. Okay, so that's on the working side. And now it would be vice versa if, say, the working side wasn't contacting and the balancing side was contacting. You would just apply these same concepts to the balancing side. And then one thing I wanted to add in here, if you had the working side contacts but not the balancing side, another option would be to make a little notch or sluiceway in the buccal, the mandibular buccal cusp, right where the palatal cusp was contacting during working side movement. And again, you could apply this to the balancing side if the opposite were true. So this is kind of like our completed diagram. If you had, colored pencils or markers or something in the exam and you could reproduce this, I think this would be pretty much all you need to know to be able to answer any question about selective equilibration. I did want to add one other drawing though, and this one is from like a facial view. So we're no longer looking from the back of the mouth, we're looking from the outside. And so this is sort of like our typical class 1 relationship where the mandibular teeth are slightly advanced, like one cusp from the maxillary teeth. And so this is our mesial side and this is our distal side. And so let's say the maxillary molars were not only shifted around vertically and horizontally, they're shifted forward. And so these maxillary molar cusps are just too far mesial. And so we would grind away the mesial inclines of the upper teeth and the distal inclines of the lower teeth. And if the opposite were true and the maxillary molar cusps were too distal, we would just grind down the distal inclines of the upper teeth and the mesial inclines of the lower teeth. So that's all I have, guys. If you have these drawings down pat and you can reproduce them with color, I think that's all you need to know. I think that'll be super helpful for the exam. And I hope this video was helpful. Give it a like if you found it helpful, and thanks for watching, guys. I'll see you all next time.